Most people think that as we get older, a certain amount of slowing down, a few more aches and pains, and some new unwelcome physical quirks are just part of the deal. We're taught to see these changes as the non-negotiable price of a long life, something to be accepted with a stiff upper lip and a quiet resignation. But what if I told you that this very mindset, this stoic acceptance of what we believe to be normal aging, is one of the most dangerous health traps a woman over 50 can fall into? What if some of the most commonly dismissed signs of getting older are not signs of aging at all, but urgent whispers from your body, clear warnings that demand immediate attention? It sounds a bit alarming, I know, especially when many of us were raised with the mantra of don't make a fuss, or don't be a bother. We've been conditioned to tough it out. But the truth is, learning to distinguish between a benign sign of aging and a serious health signal is one of the most critical skills a woman can develop for her long-term health, her vitality, and her independence. It's something more and more geriatric specialists, cardiologists, and women's health experts are desperately trying to communicate to the public. The entire system of healthcare is waking up to a new reality. The one-size-fits-all approach to health simply doesn't work, especially as our bodies change over time. The advice that was perfect for us at 30 or 40 can become irrelevant, or even harmful at 60, 70, or 80. The stoicism that once helped us power through a busy life with work and family can later prevent us from seeking care that could save our life or preserve our quality of life. The body's warning system doesn't get less effective with age. If anything, it becomes more nuanced. The challenge is that we, and sometimes even the medical community, become less attuned to its signals, writing them off under the broad, unhelpful umbrella of getting older. In this video, we're going to take a clear, compassionate, and in-depth look at 6 specific physical changes that senior women should never, ever ignore. These are the very symptoms that doctors and geriatric specialists wish their patients would report sooner. For each one, we'll explore why it's so commonly dismissed, the hidden and serious dangers it could be signaling, and what you need to do about it. This isn't about creating fear. It's about fostering wisdom. It's about giving you the knowledge and the confidence to become the most powerful advocate for your own health. You've earned a life of vitality and dignity, and that means being equipped to listen when your body speaks. Let's begin. The first change we need to talk about is what I call the out-of-shape deception. It's the sudden or significantly worsening shortness of breath. It's so easy to explain this away, isn't it? You climb a flight of stairs and find yourself winded at the top, and you think, well, I haven't been to my walking group in a few weeks. Or, I've put on a few pounds over the holidays. You might even feel a little embarrassed, chalking it up to a simple decline in your fitness level. Seems logical. After all, we aren't as young as we used to be. Many women feel that complaining about being breathless is like complaining about having gray hair. It's just an expected part of the journey. But there is a profound and critical difference between the gentle, gradual decrease in cardiovascular fitness that can happen over years and a new, sudden, or rapidly worsening inability to catch your breath. This is where a symptom that might be benign in one context becomes a potential red flag in another, and understanding that shift is crucial for your health. Let's look at the science behind why this is so important. When your body can't get enough oxygen, it's a sign that a core system is failing, and it's often one of 2 major systems, your cardiovascular system or your respiratory system. The most common excuse, being out of shape, simply doesn't account for a change in your baseline. If you've always been a little winded after 3 flights of stairs, that's your normal. But if you were fine last month and now you're breathless after just 1 flight, or worse while you're sitting still or trying to sleep, that is not normal aging. It's an alarm bell. One of the most serious possibilities is congestive heart failure, or CHF. The term sounds dramatic, but it simply means the heart muscle has become weaker and can't pump blood as efficiently as it needs to. When the heart's pumping action is compromised, blood can back up in the veins that lead from the lungs. This pressure forces fluid into the lungs' air sacs, a condition called pulmonary edema. You are, in a very real sense, drowning in a small amount of your own fluid. This is what causes that profound shortness of breath, and it's often worse when you lie down, which is why many people with CHF need to sleep propped up on several pillows. According to the American Heart Association, heart failure is a leading cause of hospitalization for people over 65, and its symptoms, especially in women, can be subtle and atypical at first. Another critical possibility is a pulmonary embolism. This is a blood clot, often formed in the deep veins of the legs, a condition called deep vein thrombosis or DVT, that breaks free, travels through the bloodstream, and gets lodged in an artery in the lungs. This blocks blood flow to a portion of the lung, which is not only life-threatening but also causes a sudden, sharp, and terrifying shortness of breath, often accompanied by chest pain. It can happen after long periods of inactivity like a long car ride or flight, or after a surgery, but it can also occur without any obvious trigger. Then there are chronic respiratory conditions like chronic obstructive pulmonary disease, or COPD, which includes emphysema and chronic bronchitis. While it's often associated with a history of smoking, a significant number of cases occur in non-smokers. COPD causes inflammation and thickening of the airways and damage to the air sacs, making it progressively harder to breathe. A sudden worsening of breathlessness could signal a COPD flare-up or exacerbation, which requires immediate medical treatment to prevent severe complications. Dismissing this as just being out of shape is like hearing a fire alarm and assuming someone is just making toast. The potential consequences are far too severe to ignore. Let me tell you about Margaret. Margaret, a 74-year-old retired teacher, was the lifeblood of her community garden. She had a sharp wit, a generous spirit, and hands that were perpetually covered in a fine layer of good soil. She'd always been active, her baseline a steady rhythm of weeding, planting, and walking her small dog, Pip. When she first noticed herself getting breathless walking up the gentle slope from the garden to her house, a walk she'd done thousands of times, she dismissed it. "Time to lay off the biscuits, Maggie," she chuckled to herself. Her daughter noticed it during a visit, watching her mother pause twice while carrying in a single bag of groceries. "Mom, are you okay?" she asked, a crease of worry on her forehead. Margaret just waved her hand dismissively. "Just getting old and slow, dear. Happens to the best of us." For weeks she adapted. She took the flatter route home, she'd ask neighbors to carry heavy things, she stopped tending the lower garden beds. She was accommodating the symptom, not addressing it. The negative consequences arrived on a Tuesday morning. She woke up feeling like a band was tightening around her chest, unable to draw a full breath. The panic was immediate and overwhelming. Her neighbor heard her gasping and called an ambulance. In the emergency room, they diagnosed her with acute decompensated heart failure. The fluid in her lungs was significant. Her current state, after a week in the hospital and now on a strict regimen of diuretics and heart medication, is one of gratitude mixed with a profound sense of regret. "I thought I was just being tough," she told her daughter, her voice quiet. "I didn't realize I was being foolish. I traded my garden for my pride." The medical community is becoming much more vocal about this. Leading cardiologists and organizations like the National Institute on Aging now stress that any new or worsening shortness of breath in an older adult should be evaluated promptly. The old protocols, which might have adopted a watch-and-wait approach, are being replaced by a more proactive stance. The understanding has evolved. We now know that the classic heart attack symptom of crushing chest pain is less common in women. For women, shortness of breath, profound fatigue, and nausea are much more likely to be the primary signs of a cardiac event. This isn't just a footnote in a medical textbook anymore. It's a headline. Geriatric specialists emphasize that their primary goal is to maintain function and independence. Ignoring breathlessness is one of the fastest ways to lose both. It leads to a spiral of decline. You feel breathless, so you do less. You do less, so you become weaker. You become weaker, and you're more susceptible to falls and other illnesses. Seeing a doctor isn't about seeking a diagnosis to worry about. It's about seeking an intervention that can keep you living the life you want to live. This brings us to a deeper, more philosophical point. Choosing to get this symptom checked is not an act of weakness or hypochondria. It is an act of profound self-respect. It is an assertion of your right to a vibrant, active life. It connects directly to your most precious values. Your independence, your ability to engage with your family and your passions, your dignity. By dismissing a symptom like this, we are unconsciously telling ourselves that we are no longer worth the effort, that our comfort and our future are secondary to the inconvenience of a doctor's appointment. But when you make that call, you are doing the opposite. You are saying, "My life is valuable. My ability to walk in my garden, to play with my grandchildren, to live without a constant struggle for air, is worth investigating. I am the steward of this body, and I will take its serious signals seriously." It is the ultimate act of taking control, of choosing wisdom over denial, and of honoring the life you have built, and the future you still deserve to enjoy. Now, let's move on to the second change that is too often misinterpreted. This brings us to number 2, a change that can feel counterintuitive because in our diet-obsessed culture, it's often met with praise, the congratulations, you're shrinking trap, or more simply unexplained weight loss. Imagine you step on the scale one morning and notice you're down 5 pounds. A month later, it's 10 pounds. Your clothes are looser, your friends are commenting on how great you look, asking for your secret. It's easy to feel a sense of accomplishment, even if you haven't actually changed your diet or exercise habits. You might think, well, my metabolism must have finally kicked into a higher gear. Or, I guess I have been eating a little healthier without realizing it. Society has so deeply ingrained in us the idea that weight loss is always a victory that we can fail to see it for what it truly is in this context. A potentially serious warning sign. The logic seems simple, losing weight is good. But the shift from helpful to harmful occurs when that weight loss is unintentional. Your body does not just decide to shed a significant amount of its mass for no reason. It's a sign that a major underlying process has changed, and that change requires immediate investigation. Let's delve into the medical reasons why this is so critical. Unexplained weight loss, medically defined as losing more than 5% of your body weight over a period of 6 to 12 months without trying, is a cardinal symptom of a number of significant health issues. Your body is like a finely balanced economy. It requires a certain number of calories to function. If it's suddenly operating at a major deficit, it means something is either dramatically increasing your body's energy expenditure or preventing it from absorbing the nutrients it needs. One of the most feared causes, and one that must be ruled out, is cancer. Many types of cancer cells are metabolically hyperactive. They consume a vast amount of energy to fuel their rapid growth and division, essentially stealing calories from the rest of your body. This phenomenon, called cancer cachexia, is a complex syndrome involving weight loss, muscle wasting, and fatigue. It's particularly common in cancers of the pancreas, esophagus, stomach, and lung, but it can occur with nearly any malignancy. Ignoring the weight loss because it feels good is like being happy your bank balance is shrinking because it means fewer numbers to keep track of. Beyond cancer, there are a host of other conditions. An overactive thyroid or hyperthyroidism is a common culprit, especially in women. The thyroid gland acts as the body's thermostat and metabolic engine. When it produces too much thyroid hormone, it's like turning the engine's idle speed way up. Your body starts burning through calories at an accelerated rate, even at rest. This leads to weight loss, but it's also often accompanied by anxiety, a rapid heartbeat, sweating, and tremors. Another major area of concern is gastrointestinal disorders. Conditions like celiac disease, an autoimmune reaction to gluten, Crohn's disease, or ulcerative colitis can cause inflammation in the digestive tract that prevents the proper absorption of nutrients, a process known as malabsorption. You might be eating a normal amount of food, but your body simply can't extract the calories and vitamins from it, leading to weight loss and nutritional deficiencies. Even psychological conditions like depression can be a cause. A loss of appetite is a classic symptom of depression, leading to a reduced caloric intake that you may not even consciously notice. Finally, uncontrolled diabetes can also cause weight loss. When your body can't use glucose for energy because of a lack of insulin or insulin resistance, it starts breaking down fat and muscle for fuel instead, leading to a drop in weight. Each of these possibilities requires a completely different treatment, but all of them require a diagnosis. Consider the story of Evelyn. Evelyn, a 68-year-old retired accountant, was known for her meticulous nature and her love of routine. She balanced her checkbook to the penny, and her weekly schedule was a model of consistency. She had always carried an extra 15 pounds that she half-heartedly tried to lose. So, when she started dropping weight effortlessly, she was quietly thrilled. Her baseline was stable and predictable, so this new development felt like a welcome surprise. The inciting incident was a dress she'd bought for her niece's wedding. It had been a bit snug, but a month later it fit perfectly. 2 months later it was loose. Her friends at her bridge club were full of compliments. "Evelyn, you look a decade younger. What have you been doing?" She'd just smile and say, "Oh, just being more careful, I suppose." The process of her denial lasted for nearly 6 months. She ignored the accompanying fatigue, writing it off as just being busy. She ignored the fact that her appetite hadn't really changed. The weight just kept melting away. The negative consequences became undeniable when she found herself struggling to lift a small bag of potting soil for her beloved rose bushes. Her arms felt weak, her body frail. It wasn't the toned, healthy weight loss she had imagined. She felt depleted. A visit to the doctor, prompted by her concerned son, revealed the truth. It wasn't a miracle diet. It was an overactive thyroid, a condition known as Graves' disease. Her current state is one of relief that it was treatable, but also deep frustration with herself. The months of untreated hyperthyroidism had put a strain on her heart. I was so flattered by the compliments, she confessed, that I ignored what my own body was telling me. I let vanity cloud my judgment. Medical authorities are unanimous on this point. The American Academy of Family Physicians, the American Cancer Society, and the National Institute on Aging all list significant, unintentional weight loss as a symptom that requires a thorough medical workup. The evolving medical understanding is that weight stability, not weight loss, is often a better indicator of health in the senior population. While obesity carries its own risks, the dangers of being underweight or experiencing rapid muscle loss, sarcopenia, in older adults are equally severe. It increases the risk of falls, fractures, and a diminished ability to recover from illness or surgery. The protocols are clear. A doctor should conduct a detailed history, a physical exam, and a series of blood tests to investigate the cause. They're not just looking for one thing. They're looking for patterns that point toward a thyroid issue, a metabolic problem, a hidden infection, or something more serious. They are being a detective for your health. This leads us to a crucial reframing of our values. In a world that screams thinner is better, choosing to question weight loss is an act of profound wisdom. It's a rebellion against a superficial cultural narrative, and an embrace of a deeper truth about your own well-being. This isn't about rejecting a compliment. It's about understanding the context. It's about prioritizing your strength, your energy, and your resilience over a number on a scale or the size on a clothing tag. Your true goal isn't to be smaller. It's to be stronger. It's to have the physical capacity to remain independent, to travel, to play, to live fully. Seeing a doctor about unexplained weight loss is a declaration that you value your muscle mass over social praise, your long-term health over a short-term aesthetic. It's the ultimate act of choosing substance over surface, and of asserting that you are the one who defines what a healthy body feels like, not the fleeting opinions of others. The third change we must discuss is often shrouded in embarrassment, which makes it one of the most dangerously ignored. I'm talking about the just a sensitive system excuse, which is used to dismiss significant or persistent changes in bowel or bladder habits. This can manifest in many ways. A new and persistent constipation or diarrhea, a change in the color or consistency of your stool, blood in the stool or urine, or a new and urgent need to urinate frequently, especially at night. It's so easy to write these things off. We think, I must have eaten something that disagreed with me, or everyone's bladder gets a little weaker with age. Women, in particular after childbirth and menopause, are often told that urinary changes are just a fact of life. The topic is private, a little undignified, and certainly not something you bring up at the dinner table. So we keep it to ourselves, we buy different products at the pharmacy, and we adapt our lives around the problem. But this adaptation can be a fatal mistake. A change in these fundamental bodily functions is a direct message from your core, and it needs to be decoded by a professional. Let's be very clear about the potential medical realities. Your digestive and urinary tracts are complex systems, and a lasting change in their output is a sign of a significant shift in their internal environment. Let's start with bowel changes. A persistent change, like a new onset of pencil-thin stools, can indicate a partial obstruction in the colon, something that could be caused by a polyp or a tumor. Blood in the stool, whether it's bright red or dark and tarry, should never be ignored. While it can be caused by something as benign as hemorrhoids, it is also a hallmark symptom of colorectal cancer, which is the third most common cancer diagnosed in both men and women in the United States. According to the American Cancer Society, rates have been increasing in younger people, but the majority of cases still occur in adults over 50. Early detection dramatically improves outcomes, and ignoring a clear sign like this is a gamble you cannot afford to take. Persistent diarrhea or constipation can also signal inflammatory bowel disease or other serious digestive issues. Now let's talk about urinary changes. While an overactive bladder is a common condition, a new and sudden onset of urinary urgency or frequency, or blood in the urine hematuria, can be a sign of several serious problems. The most immediate concern is a bladder infection or a urinary tract infection, UTI. In younger people, a UTI usually presents with burning and pain. In older women, however, the symptoms can be much more subtle and confusing, sometimes presenting primarily as sudden confusion or delirium, which we'll discuss later. But it can also be a sign of bladder cancer. Blood in the urine is the most common sign of bladder cancer, and it's often painless. It might happen once and then go away for weeks or months, leading to a false sense of security. Another major concern, specifically for women, is that pelvic and urinary symptoms can be a sign of gynecological cancers, like ovarian or uterine cancer. Ovarian cancer has long been called the silent killer because its symptoms are so vague and easily dismissed. They include bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, and urinary symptoms like urgency or frequency. Because these sound like so many other minor ailments, women often wait until the disease is in an advanced stage before seeking help. Let me share a story about a woman named Carol. Carol was a 66-year-old retired florist, a woman who found joy in creating beauty for others. Her life was full of color and texture. Her baseline health was excellent, though she'd always managed what she called a fussy stomach. So when she started experiencing a nagging constipation, alternating with bouts of diarrhea, she didn't think much of it. The inciting incident was a family cruise she was planning. She found herself worrying constantly about the bathroom situation, packing an arsenal of over-the-counter remedies. Her focus wasn't on the beautiful destinations, but on managing her gut. This should have been a red flag, but she just pushed through, telling herself it was nerves. The process of her dismissal went on for almost a year. She'd mention it offhandedly to friends who would say, "Oh, my system is the same way," normalizing her experience. She changed her diet a dozen times, blaming gluten, then dairy, then nightshades. She was doing everything except the one thing that mattered, seeing a doctor. The negative consequences came to a head when she noticed a small amount of dark blood in her stool. Even then, she waited 2 more weeks, hoping it would go away. When she finally made an appointment, the colonoscopy revealed a stage 3 colon tumor. Her current state is one of grueling recovery after surgery and chemotherapy. She is cancer-free, but the journey has been brutal. "I was so embarrassed to talk about it," she says, her voice filled with a quiet anger at herself. "I was willing to discuss my finances, my family problems, anything but this. That embarrassment almost cost me my life." The medical establishment is trying to fight this culture of silence. Organizations like the Colorectal Cancer Alliance have campaigns like "Don't Assume" to encourage people to get symptoms checked. Gynecological oncologists repeatedly stress that the vague symptoms of ovarian cancer, the bloating, the pelvic pressure, the urinary changes, are significant when they are new, persistent, and occur almost daily. The evolving understanding is that our bodies don't have that many ways to signal a problem in the abdominal and pelvic cavity. These subtle shifts in function are the primary language the body uses. The protocol for a doctor is straightforward: a careful history, a physical exam, which may include a rectal or pelvic exam, and then ordering the appropriate tests, whether that's a urinalysis, a stool sample test, or a referral for a colonoscopy or ultrasound. These procedures might be uncomfortable, but they are infinitely less uncomfortable than a late-stage cancer diagnosis. If you're still watching this video and finding these insights valuable, please comment the number 3 below to let me know you're here. It helps me know that this information is reaching the people who need it. And if you haven't subscribed yet, I highly recommend you do and turn on the notification bell so you don't miss any of our future videos. Your support helps us continue creating good, empowering content to inform and inspire you. Now let's move forward to our next critical point. This brings us to a philosophical shift in how we view our bodies. The decision to discuss these impolite symptoms with a doctor is a profound act of maturity and self-advocacy. It is about choosing health over humiliation, choosing life over a misplaced sense of privacy. Your dignity is not compromised by talking about your bodily functions with a medical professional. Your dignity is compromised when you allow a treatable condition to rob you of your health and independence because of embarrassment. This connects directly to the value of living an unconstrained life. You deserve to plan a trip without worrying about bathrooms. You deserve to eat a meal without anxiety. You deserve to live without that nagging fear in the back of your mind. By making that appointment, you are reclaiming control. You are refusing to let shame dictate your health outcomes. It is an act of courage, an act of wisdom, and an act that declares your well-being is more important than any outdated social taboo. The fourth change is one of the most frightening for both the woman experiencing it and her family, and it's often mislabeled as the senior moment fallacy. I am talking about a sudden onset of confusion, significant memory gaps, personality changes, or delirium. It's so tempting to see an older loved one or even yourself have a moment of confusion and think, oh, she's just having a senior moment. Or worse, to jump to the conclusion that it's the beginning of Alzheimer's. The fear of dementia is so profound that it can lead to a strange kind of denial. We either dismiss the symptom as trivial or we accept it as an irreversible and tragic fate. But the truth is, a sudden and acute change in mental status is almost never just a senior moment, and it is often not dementia. It is a medical emergency until proven otherwise. The brain is the command center of the body, and when it suddenly goes offline like that, it's a sign that something is poisoning the system, cutting off its supply lines, or that the brain itself has suffered a direct injury. Let's get into the hard science of this. The brain requires a very specific environment to function. A steady supply of oxygen and glucose, a stable chemical balance, and freedom from inflammatory toxins. When an older person suddenly becomes confused, aggressive, or withdrawn, it's often a sign that one of these things has gone terribly wrong. The number one culprit that every geriatrician will look for first is a urinary tract infection, or UTI. As I mentioned earlier, the classic UTI symptoms of pain and burning are often absent in older adults. Instead, the bacteria in the urinary tract release inflammatory substances into the bloodstream that can cross the blood-brain barrier, causing a state of delirium. The change can be dramatic, happening over just a day or two. A woman who was perfectly lucid on Monday might be hallucinating or unable to recognize her family by Wednesday. It is one of the most common and most treatable causes of acute confusion in seniors. Another major cause is a stroke or a transient ischemic attack, TIA, often called a mini-stroke. A stroke occurs when blood flow to a part of the brain is cut off, either by a clot or a bleed. Depending on the part of the brain affected, the symptoms can vary wildly. It isn't always the dramatic one-sided paralysis we see in movies. It can manifest as sudden confusion, trouble speaking or understanding speech, aphasia, sudden memory loss, or a drastic personality shift. A TIA has similar symptoms, but they resolve within 24 hours. However, a TIA is a massive warning sign that a major stroke could be imminent. Dehydration and electrolyte imbalances are another common cause. As we age, our sense of thirst can diminish, making it easy to become dehydrated, especially during hot weather or illness. When the body is low on fluids, blood volume drops and sodium and other electrolyte levels can become dangerously concentrated, severely impacting brain function. Other possibilities include adverse reactions to medication or interactions between medications, thyroid problems, vitamin B12 deficiency, or even a silent heart attack, which can reduce blood flow to the brain. The list is long, and many of the causes are completely reversible if caught in time. I want to tell you about Arthur, who is sharing the story of his wife Jean. Jean was 77, a sharp-witted former bridge champion with a laugh that could fill a room. Her mind was her most prized possession. Her baseline was one of complete lucidity and engagement with the world. The inciting incident was subtle. Over a weekend, she became quiet and withdrawn. On Monday, Arthur asked her what she wanted for breakfast, and she stared at him blankly, unable to answer. He asked again, and she became agitated and accused him of being a stranger in her house. The process of his reaction was pure panic. His mind immediately went to Alzheimer's, the disease that had taken his own father. He was terrified, picturing a long, slow goodbye. He felt helpless, watching the woman he loved disappear before his eyes. The negative consequences of his fear were that he almost waited. He thought, what can a doctor do for Alzheimer's anyway? He considered just calling their children to break the terrible news. But a small, rational part of his brain, a voice that sounded a lot like his practical wife, told him to call their doctor. The doctor told him to bring her to the emergency room immediately. After a simple urine test, the diagnosis came back: a severe UTI. Her current state is that she is completely back to her old self. After a course of antibiotics, her confusion cleared within 48 hours. Arthur is now a passionate advocate for this cause. I almost grieved the loss of my wife when all she needed was a simple antibiotic, he says, his voice thick with emotion. Don't assume the worst. Assume it's treatable until a doctor tells you otherwise. The medical consensus on this is absolute. The American Geriatric Society and the National Institute on Aging have published extensive guidelines for evaluating acute delirium in older adults. The protocol is to think UTI first, then move through the list of other potential reversible causes. The evolving understanding is that the aging brain has less cognitive reserve. It's more sensitive to insults from the rest of the body. An infection or imbalance that a 30-year-old's brain could easily handle can send a 75-year-old's brain into a tailspin. This is not a sign of a bad brain. It's a sign of a sensitive, highly reactive system. Doctors are trained to see sudden confusion not as a psychiatric issue first, but as a medical one. It's a symptom just like a fever or a cough, pointing to an underlying physical problem. This reality calls for a profound philosophical shift from fear to inquiry. When we see these symptoms, our first response should not be the terror of an irreversible diagnosis, but the urgent curiosity of a detective. What is the body trying to tell the brain? What system is out of balance? This reframes the situation from one of passive tragedy to one of active problem-solving. It empowers the family and the patient to seek answers, not to surrender to assumptions. It honors the person by not immediately writing them off. It's an act of hope and respect. By calling the doctor, you are not just seeking a cure. You are refusing to accept a premature cognitive eulogy. You are affirming the value of that person's mind, their personality, their essence. You are standing in the gap for them, demanding a thorough investigation before a verdict is rendered. It's a powerful stance that chooses action over despair and prioritizes the person over the fear. Let's move on to our fifth point, which is about a symptom so common it has become background noise for many: the "it's just arthritis" trap, used to explain away persistent, localized pain. This is pain that isn't everywhere, but is lodged in one specific area, particularly the back, pelvis, or deep in the abdomen. As we age, aches and pains seem to come with the territory. We get a twinge in our back and think, I must have slept on it wrong. A deep ache in our pelvis is dismissed as female troubles, or the ghost of old menstrual cramps. Abdominal pain is blamed on something we ate. We have a whole vocabulary of dismissal for pain because to acknowledge it fully feels like giving in. We take an over-the-counter pain reliever and carry on. But persistent, focused pain is not the same as the generalized, wandering aches of fibromyalgia, or the morning stiffness of common osteoarthritis. Localized pain is your body putting a spotlight on one specific area, and it's a signal you must heed. Let's explore the critical medical conditions that can hide behind the mask of simple aches and pains. When a woman over 50 experiences persistent new back pain, especially pain that isn't relieved by rest, it requires a closer look. While it could be a muscle strain or a vertebral issue, it can also be a sign of something much more serious. It can be referred pain from an internal problem. For example, pancreatic cancer can often present with a deep, boring pain in the upper abdomen that radiates to the back. An abdominal aortic aneurysm, which is a dangerous bulge in the main artery that carries blood from the heart, can cause a deep, tearing pain in the back or abdomen. This is a medical emergency. Even a heart attack in a woman can present not as chest pain, but as severe back or jaw pain. Now let's focus on that vague pelvic and abdominal pain. This is where we see the insidious nature of ovarian cancer again. As we mentioned, the symptoms are bloating, pelvic pressure, and abdominal pain. It feels like gas, indigestion, or a minor cramp. The key difference is that it doesn't go away. It's there day after day, a low-grade but persistent presence. Because the pelvic cavity has a lot of open space, a tumor can grow to a significant size before it starts pressing on other organs and causing more dramatic symptoms. This persistent, vague discomfort is often the only early warning sign there is. According to the Ovarian Cancer Research Alliance, only about 20% of ovarian cancers are found at an early stage, largely because these symptoms are so easily ignored. Similarly, uterine or endometrial cancer can present with pelvic pain and pressure, in addition to abnormal bleeding. And pain in the upper right side of the abdomen could signal problems with the liver or gallbladder. The point is, your body doesn't have a separate alarm for every single organ. Pain is a crude but effective tool, and when it stays in one place, it's pointing. I want you to meet Susan. Susan was a 62-year-old grandmother who prided herself on her toughness. She had raised 3 boys and worked for 30 years on her feet as a hairdresser. Her baseline was a state of constant motion and a high tolerance for discomfort. The inciting incident was a dull ache that settled deep in her pelvis. It wasn't sharp, just a constant, heavy pressure. She told herself it was probably a bladder issue or the beginnings of arthritis in her hips. She was the primary caregiver for her husband, who had Parkinson's, and she felt she simply didn't have time to be sick. The process of her dismissal was fueled by her role as a caregiver. Her focus was entirely on her husband's needs. She'd pop a couple of ibuprofen in the morning and get on with her day, pushing the sensation to the back of her mind. When her sister asked her about the way she was constantly rubbing her lower abdomen, she'd just say, "Oh, it's nothing, just old age creeping in." The negative consequences mounted slowly. She started feeling full after only a few bites of food. She became more and more bloated. She thought she was gaining weight, even though her appetite was poor. The pain finally became so bad that it woke her from her sleep. A visit to the emergency room and a subsequent CT scan revealed the devastating truth. Stage 4 ovarian cancer, spread throughout her abdominal cavity. Her current state is one of fighting a valiant but difficult battle. Her biggest regret is not the cancer itself, but the time she lost. "I thought being strong meant ignoring my own pain," she said, her voice thin but firm. "I now know that real strength is asking for help. I was so busy taking care of my husband that I forgot to take care of myself." If this is resonating with you and you're finding this information helpful, please let me know in the comments which of these points has surprised you the most so far. Your feedback is so valuable and helps us create content that truly serves you. The medical community is desperately trying to change this narrative. Gynecologists, oncologists, and primary care physicians are now trained to ask women about these vague, persistent symptoms. The BEAT acronym for ovarian cancer awareness is a great tool. B for bloating, E for eating difficulty, A for abdominal or pelvic pain, T for trouble with urination. If these symptoms are new and frequent, it warrants a conversation with your doctor. The evolving medical wisdom is that pain is a vital sign, just as important as blood pressure or temperature. It's not just a subjective feeling, it's a piece of diagnostic data. The protocol is not to immediately jump to the worst-case scenario, but to take the symptoms seriously, to conduct a thorough physical exam, and to use imaging like an ultrasound or CT scan to look at the structures underneath the site of the pain. This calls for a redefinition of toughness. True strength is not the ability to endure pain silently. It is the wisdom to listen to what the pain is telling you. It is the courage to admit vulnerability and seek help. Ignoring your body's signals is not stoicism. It is a form of self-neglect. Your life, your health, and your future are not less important than your families, your work, or your other obligations. In fact, by taking care of yourself, you are ensuring you can continue to be there for the people and things you love. It's the old oxygen mask analogy on an airplane. You must put on your own mask first before you can help others. Addressing your pain is putting on your oxygen mask. It is an act of responsibility, an act of self-love, and a testament to the value you place on your own life. It is choosing to be an active participant in your health journey, not a passive victim of your symptoms. Finally, we arrive at our 6th and final point, an event that is incredibly common and almost universally downplayed: the "I'm just clumsy" excuse after a fall. A woman stumbles on a rug, trips on an uneven bit of pavement, or simply loses her balance and falls. If she gets up and feels okay, maybe just a little bruised and embarrassed, the overwhelming tendency is to dismiss the incident entirely. She might say, "I've always been a bit clumsy," or "I really need to get new glasses," or "I just wasn't paying attention." The fall itself is seen as the problem, rather than a symptom of a much larger, underlying issue. But in the world of geriatrics, a fall is never just a fall. It is a sentinel event, a major predictor of future health outcomes, and a flashing red light that an underlying system may be failing. Let's break down the complex web of reasons why a fall is such a critical warning. First, let's consider the direct consequences. A fall can lead to fractures, with hip fractures being the most devastating. A significant percentage of seniors who break a hip never regain their former level of mobility, and it can be a major trigger for a loss of independence. But the fear of falling again can be just as disabling as the fall itself. This fear leads to a self-imposed restriction of activity. You stop going for walks, you avoid stairs, you turn down social invitations. This leads to physical deconditioning, muscle weakness, and social isolation, which in turn, ironically, makes you even more likely to fall again. It's a vicious cycle. But more importantly, we need to ask, why did the fall happen? Clumsiness is a personality trait. An unexplained fall is a medical symptom. The list of potential underlying causes is extensive and serious. Could be a cardiovascular issue. A heart arrhythmia, which is an irregular heartbeat, can cause a sudden drop in blood flow to the brain, leading to a moment of dizziness or a brief loss of consciousness that results in a fall. A condition called orthostatic hypotension, which is a sharp drop in blood pressure upon standing up, is another common cause. It can be a side effect of many common medications for blood pressure or depression. The fall could also be neurological. Undiagnosed Parkinson's disease can affect gait and balance long before the more well-known tremors appear. Peripheral neuropathy, which is nerve damage in the feet often caused by diabetes, can rob you of the sensation you need to feel the ground properly, leading to instability. Inner ear problems like benign paroxysmal positional vertigo (BPPV) can cause sudden, intense bouts of dizziness. Even something as simple as poor vision that needs a new prescription or cataracts can be the culprit. The fall isn't the disease. It's the smoke from a fire smoldering somewhere in the body. Let's talk about Robert's mother, Helen. Helen was 81, a fiercely independent woman who still lived in the house where she'd raised her children. She was proud of the fact that she needed no help. Her baseline was one of total self-sufficiency. The inciting incident was a fall in her kitchen. She was reaching for a box of tea and simply crumpled to the floor. She wasn't hurt, just shaken. When Robert came over and saw the bruise on her cheek, she was deeply embarrassed and angry at herself. "I just tripped over my own 2 feet, for heaven's sake. Don't you dare start treating me like an invalid," she warned. The process of her dismissal was adamant. She rejected Robert's suggestion to see a doctor. She rejected his offer to install grab bars in the bathroom. She saw any attempt to help as a threat to her independence. A few weeks later, she had another fall, this time while getting out of a chair. Again, she was uninjured, but her confidence was visibly shattered. The negative consequences came a month later. She fell in the bathroom, and this time she wasn't so lucky. She fractured her hip. The surgery was successful, but the recovery was long and arduous. It was during her hospital stay that the underlying cause was finally discovered. An EKG revealed she had atrial fibrillation, a heart arrhythmia that was causing her to have brief moments of near fainting. Her current state is that she now lives in an assisted living facility. She has a pacemaker and is on blood thinners. She is safe, but she has lost her home and a significant measure of her prized independence. "My pride broke my hip," she told Robert. "If I had just let the doctor figure out why I fell the first time, I might still be in my own home." The medical community is united on this. The Centers for Disease Control and Prevention (CDC) has a whole initiative called STEADY, Stopping Elderly Accidents, Deaths and Injuries, aimed at helping healthcare providers make fall prevention a routine part of clinical care. The protocol is clear. Any patient over 65 who has had a fall in the last year should be screened for future fall risk. This involves reviewing their medications, checking their vision, assessing their gait and balance, and investigating for underlying heart or neurological conditions. The evolving understanding is that falls are not an inevitable part of aging. They are a preventable medical issue. By treating a fall as a diagnostic clue, doctors can often intervene and fix the root cause, whether it's by changing a medication, prescribing physical therapy to improve balance, or treating an underlying heart condition. This brings us to our final and most empowering philosophical point. To report a fall to your doctor is to choose foresight over pride. It is an act of profound strategic wisdom. It is acknowledging a small problem now to prevent a catastrophic one later. It is not an admission of frailty. It is a declaration of your intent to remain strong and independent for as long as possible. It's about valuing your future mobility over your present embarrassment. So many of us equate independence with refusing help. But true independence is having the wisdom and resources to maintain your autonomy. Seeking a medical evaluation after a fall is one of the most powerful tools you have to do just that. It is an investment in your own future. A proactive step to ensure that you can continue to live life on your own terms, safely and confidently. It is the ultimate expression of control over your own destiny. Reaching your senior years doesn't mean entering a phase of inevitable decline and quiet acceptance. If anything, it's the time when your wisdom, your experience, and your self-knowledge are at their peak. It is the time to question the systems and the assumptions that tell you to just grin and bear it. There is a deep and profound courage in learning to do less of the wrong thing. Less ignoring, less dismissing, less stoic suffering. Not out of neglect, but out of a deeper understanding of what truly matters for your health and well-being. The 6 changes we've discussed today are not just a list of symptoms. They are a call to a new kind of partnership with your own body and with your healthcare providers. This stage of life deserves a different kind of healthcare. It should be about conversation, not a conveyor belt of tests and dismissals. It should be about honoring your health, not just chasing disease. It is about a deliberate and proactive engagement with your well-being, rather than a reactive scramble when things go wrong. When you notice one of these changes, the breathlessness, the weight loss, the digestive upset, the confusion, the localized pain, the fall, you are not a burden for bringing it to a doctor's attention. You are a vital source of information. You are the world's leading expert on your own body and how it feels day to day. Your subjective experience is not just a story. It is clinical data of the highest order. When you go to your doctor, I encourage you to be an empowered advocate. You have the right to ask questions. Ask, is this a normal part of aging? Or is this a new change for me? Ask, what could this symptom be pointing to, and what do we need to do to investigate it? It's about weighing the benefits of knowing against the burden of not knowing. The burden of a test or a procedure is temporary, but the burden of a misdiagnosis can last a lifetime. Your time, your energy, your comfort, and your peace of mind are valuable commodities. Investing a small amount of them in getting answers is one of the wisest investments you can possibly make. You have earned the right to be heard. You have earned the right to be taken seriously. You have earned the right to live a life that is not defined by fear or by symptoms that have been ignored. The wisdom of age is not just in what you know about the world, but in what you know about yourself. Trust that wisdom. Honor those signals. Live your life on your terms with clarity and confidence. Not dismissal but discernment. Not passivity but partnership. Not fear but foresight. This is the path to a life that is not just long, but is rich, vibrant, and deeply and truly your own.